looking to have this be an inclusive space. We're able to explore the essential role of doulas in providing affirming care for LGBTQ plus families with a focus on intersectionality, reproductive justice, and community-based support. So for me, I'm going to emphasize the role of advocacy and radical love in certain spaces as we all go through changes. Life is full of those. So we'll be highlighting the importance of advocacy for BIPOC, queer, and trans birthing families, and where we understand where trauma-informed care and community-based support for all families comes into play. All right, so I'm going to pull up my presentation here, and then I'll share my screen with you all. All right, so that should be pulling up for us here shortly. Let me know if anybody is having any trouble hearing me or seeing my screen. I know sometimes it gets a little bit choppy once you share. And just to let everybody know, I won't be able to see the chat while I'm presenting, but if there's anything that needs a call out, Natalie, you're more than welcome to let me know to be my eyes and ears. All right, so again, I am Kylia Dantzler-Morgan. I'm a community-based doula and a community health worker. I'm the owner of You Are Seen Doula Services. So today, again, we'll be talking about affirming doula care for LGBTQ plus families and how we can navigate support in a changing political climate. All right, so who am I? Who is this person talking to us today? I'm Kylia. Advocacy and action is what I strive for as a Black queer neurodivergent doula. My identity deeply informs my practices and how I advocate, not just as a doula and a community health worker, but also as an abolitionist. My care is rooted in that, understanding that certain systems are working as they're designed, and just figuring out ways that we're able to uplift marginalized voices when it comes to reproductive care and having voices when it comes to our healthcare choices in our bodies. All right. So why does this particularly matter right now in this day and age? Understanding that autonomy is urgent always. Understanding that even with changing legislation, changing administrations, Roe v. Wade was overturned during a Democratic presidency. So unfortunately, we can't say that Democrat or Republicans are better in times of changing things when it comes to legislation over our bodies. That creates this growing distrust within healthcare for marginalized communities, increasing maternal mortality rates for birthing people. We know that Black and Brown birthing people experience mortality rates 3 to 4 times more likely than their white counterparts, which continues to be heightened and worsened in this current political climate. And then when we're looking at, again, legislative attacks on our rights, recent laws when it comes to abortion access, timelines of when it's deemed acceptable for a person to make that decision to abort a pregnancy, and then how we're looking at community advocacy surging during these times of increasing challenge and fear. So yeah, always understanding the urgency of reproductive justice, and equitable care. All right. So when we look at the role of doulas as far as barriers in birth work, how this looks like as far as systems interactions, a lot of the times we'll see people make decisions as far as whether they want to birth in a hospital setting, at home, or in a birthing center. Those are a lot of times based on barriers in birth work or birthing choices. So oftentimes what we'll see is misgendering in healthcare. Many LGBTQ individuals and families frequently face misgendering during their healthcare experiences, which affects their overall comfort and trust in the care that they're receiving. Also pertaining to the access to services. So knowing that LGBTQ plus families are facing systemic inequities and lack of inclusive care, whether that be respecting pronouns, whether that be respecting choices over their body, receiving informed decision-making and information that will influence the decision they'll make over a pregnancy and a birth and postpartum. Also provider biases. Unfortunately, with some changes to legislation, we understand that providers aren't obligated to uphold certain standards of care when it comes to people being able to make certain decisions for themselves. Oftentimes, we'll also see with them presenting people with uteruses that they'll not have the option to opt for hysterectomy before they've ever had children. A lot of times doctors will input and interject and state that, you know, why don't you check in with your partner to see if they're wanting to have kids before you make the decision to have a hysterectomy before you birth the child first. Or even how do you consider how this will impact your child being in a same-sex marriage or a same-sex couple, or even as a single parent who's wanting to bring forth life. And lastly, we're looking at both things that tie into each other, cultural competency gaps when it comes to different religions, cultures, ethnicity, race, nationalities within the Western healthcare system. A lot of the times they don't have that training to understand the importance of cultural competency and care, and that creating or exacerbating mental health disparities for people who live with mental health struggles every day. All right. So then we're looking at what do doulas offer in terms of these challenges and these barriers within healthcare. So first thing is identity affirming care. So doulas provide a safe space for all identities during birth. That's what inclusive doula care looks like, specifically for trauma-informed support, being able to recognize and respond to trauma in birthing people. And last but not least, of course, advocating for families. Doulas not only advocate for our clients, who is the birthing person, but also the partner in the family support, friend support systems who are going to be there throughout their journey. And then just diving deeper into the intersectionality in practice, we look at different layers of barriers. So when we think of intersectionality, we're wondering, what does that word mean? So specifically, intersectionality recognizes differing identities for people. As I mentioned before, and I'm not only a Black doula, I'm also a queer doula, neurodivergent. So these are different identities that tie into who I am as a whole person. And that's something that as doulas, we try to recognize in the care that we provide. And then we look at as well collective liberation. Working together fosters collective strength and resilience against systemic oppression. So we understand that we're stronger together versus as individuals, and being able to gather our strengths, our experiences, and our knowledge to be able to address certain systemic oppression. And then the most important is empowering communities, so creating authentic dialogue that strengthens our shared commitment to liberation. Again, understanding that no one person is a monolith, and being able to bring our full selves into certain conversations, all conversations, to be able to address and come up with resolution. And then specifically, why do Black doulas matter? So with Black doulas, a lot of us are not as visible in these spaces. When you look at overall the new surge in doula care for birthing people, culturally, we have been here since enslavement, being able to provide care to enslaved families, nursing, caring, and raising children. So we understand the impact and the overall duty that comes with this, not by choice, but through generational trauma in learning. And then our role specifically has always been challenging systems, confronting and disrupting biases within healthcare environments. So understanding that a lot of the time, healthcare decisions and the overall system of healthcare wasn't made with Black people in mind, or their marginalized communities. So we have to be able to speak up and challenge certain things and make sure that it's inclusive in the way that it considers what care looks like and how that it should be formed for each individual person and their needs. And then lastly, empowerment through advocacy. We understand that fosters trust and empowerment in people's birthing experiences and the choices that they choose to make coming into their birthing spaces and the interactions that they have with providers and healthcare systems. So understanding that they do have the power to make decisions over their bodies. There's no policy that can tell them what they can and cannot do when it comes to their birthing experience in that journey. All right. And then LGBTQ plus affirmation and care. For me specifically, I provide gender neutral paperwork, just implementing inclusive forms for all of my clients so that they feel respected and recognized in their identities. So ensuring that as we go throughout the process of their birthing journey, I'm providing space and opportunities for them to feedback and let me know certain things that they need, whether it be from me directly, from their support systems, or even their providers, and collaborating through those partnerships with those providers, their care teams, and then also looking at building alliances with affirming organizations. Because as a doula, I would love to do it all, but there are certain things that aren't within my scope of practice. So being able to build networks with people that I trust with my clients' care and their overall well-being, physically, mentally, and spiritually. And then looking at as well at community feedback. So always being open to gathering community feedback from my clients directly, as well as to anything when it comes to resources. So understanding that when you do refer out, or do you have certain things that are available to clients to be able to feedback, whether that's their experience or the experience from myself, another provider, so on and so forth. And then also looking at training and education. So continuously opening myself up for opportunities to learn more. There's never done learning. So being able to be open to different opportunities to learn and train, not just on LGBTQ plus issues, but other things that foster a supportive and knowledgeable practice to be able to address certain things. So understanding that I don't know all the answers and being open to always research and learn more. And of course, that all ties into celebrating diversity, so recognizing and honoring the rich diversity within LGBTQ plus communities that strengthens our work and other intersectional personalities and identities. And then providing client-centered support is what doulas aim to do. So we're respecting chosen families. So again, that doesn't always mean a person's family that they are connected to by blood, but also looking at chosen families a lot of the times for people who are marginalized, whether that be by sex, gender identity, sexual orientation, so on and so forth. A lot of the times they experience things where they're not accepted and they don't have the support that they need. So they have to go outside of that nuclear family to be able to create a community that they are nurtured and supported by. And then also looking at informed consent practices. So understanding again that decision-making is supposed to be an empowering experience for them and ensuring that they feel safe and respected throughout their care, whether that is them deciding to follow the advice of a provider or understanding that and trusting their bodies to say that I have this information, but for me in this time and point, this is a decision that I want to make against maybe the provider's advice, so still being able to do that. And then also doulas are able to tailor our referrals, again, referring to affirming resources that help navigate the healthcare landscape versus just going with the flow of how things are supposed to look. So being able to tailor that to each individual client and their families. And then also looking at community engagement. So again, engaging with local organizations that fosters an overall supportive network who are safe for LGBTQ plus and BIPOC families, just to ensure that they feel uplifted and seen throughout their birthing journey. And then again, tying back to advocacy training, it's not a one size fits all model. There's a few different kinds out there, but specifically, advocacy is able to equip families to navigate challenges and assert their rights during care. We would love to all be born with this ability to speak up and speak out. But again, those experiences that we have and move throughout life sometimes affects our ability to do that. So further into that, how do we address harm and how do we help people understand their rights? So unfortunately, throughout certain healthcare interactions that we talked about and touched on earlier, people don't always have the best experiences and they don't always understand certain things that are available and given to them. So doulas are able to help navigate how we address their harm and how they understand their rights. So specifically within healthcare, there are grievance processes, whether that be through the healthcare provider, through the healthcare system directly, but there are a few different avenues for how to start a grievance process, just so that people are able to get feedback and provide some type of avenue for them to address and express those concerns and experiences. And then sometimes, unfortunately, there are instances where the grievance process isn't adequate enough to address the level of harm that people experience during these certain instances. So looking at what are the legal protections, things as far as civil suits, a big one being, again, referral networks. So certain attorneys who are LGBTQ plus friendly and understand just like the overall landscape, the law, and how to advocate for this person's experience. So when we look at the data, the numbers always are a clear indicator. They're not just numbers, they tell a story. So understanding how our community needs are affecting their overall reproductive care. So we know that 53% of LGBTQ plus people in Kent County reported a lack of trust in healthcare providers in the 2023 Community Health Needs Assessment, which is typically administered through providers, healthcare systems, or even interactions with other healthcare, public health people. And looking further into how LGBTQ plus birthing individuals who received affirming doula care reported a 66% decrease in anxiety. So whether that be interacting in their healthcare decisions, their choices within certain hospitals, and even asking questions, which also led to a 48% increase in the trust toward healthcare providers and nearly double the rate of positive birth experiences compared to those without affirming support, whether that be a doula, a support person, family member, friend, so on and so forth. So one of my really favorite quotes here, community care is a revolutionary act of love and resilience. So then we get into how do we build community? A lot of times we'll hear, again, chosen families or communities that are chosen. But what this looks like for doulas and birthing people, a lot of the times is formation of alliances. So understanding that things happen at the root, grassroots efforts that unite diverse groups to advocate for inclusive healthcare access. Again, we're stronger together than as individuals. And then creation of BIPOC doula collectives. There are a few here in Grand Rapids, but throughout the state of Michigan, as far as the importance of the intersectionality when it comes to culturally competent support for marginalized families and the experiences that they have. And then we're also looking at the expansion of community sources. So when we look at changing political climate, a lot of the times funding, access, those things are cut back or no longer available to birthing people. So having to look at things like mutual aid, where we're able to look at pulling together our own resources, whether that is individuals, communities, neighborhoods, cities, and being able to provide the resources available for LGBTQ plus and BIPOC birthing people. And then another huge part of building community is advocating for policy changes, whether that is at a local level, state level, national level, but looking at how do we build and mobilize strength and resources to push for reproductive rights and equitable healthcare policies. A lot of the times we've seen lately there are pushes for phone trees, emails, GoFundMe. So all of these things are looking at policy change and how do we connect with each other to let the issues be known and supported by all. And then as far as birthing people in particular, launch of support groups. So we'll see a lot of support groups that are specific to human milk feeding, also known as breastfeeding or chest feeding. So being able to foster an environment where people are able to learn about the advantages, struggles of other people who are also in postpartum periods where they're feeding their babies, and understanding that even with changing legislation again, when it comes to being able to feed in public, and just letting the experiences about those things be known to foster connection and resilience amongst birthing people. All right, and then action steps. Now that we have this information, what does that look like as far as addressing the changes in the political climate? So again, we look at three main things: policy, organizing, and joy, which is very important. So understanding the awareness of the policies and how those changes are affecting people in their everyday lives. So not understanding just like the policy changes, but how this impacts people and why it's important for communities and us as a whole. So understanding that oppression of one person is oppression of us all. None of us are free until we're all free. So understanding that when you see an issue that impacts one specific community, it will impact you eventually in a different way because oppression is oppression. And then organizing together, so building strong coalitions that fosters collective strength. Again, uniting those efforts to challenge those systems takes a big responsibility, and we are more than capable of being able to do that effectively and sustainably. And then most importantly, my favorite thing is joy. You always have to smile, find the moments where you can be joyful. That fuels our ability to be resilient, and it just reminds us of the importance of community care and who we're fighting for. All right. So what I'm going to do here now is open it up for discussion. You're welcome to come off of mute, turn on your cameras if you're open and comfortable with that. But we can focus on, or we can go outside of these four main things that I touched on. But whatever you all would like to talk about.
Kylia, this is Jenny. I have one question for you.
Yeah.
I've been in healthcare a really long time, and I've heard about doulas for many, many years, but they weren't really mainstream. It's like the systems weren't really using them. But I've noticed in the last couple of years that they seem to be becoming more part of healthcare. Do you have any information about how that came about?
Yes. So with a lot of the changes for specifically the Michigan Department of Health and Human Services, they're offering grants and funding to do a training program. So there are some doula collectives, some organizations that are providing more funded doula training, whether that be a weekend, 6 weeks, 14 weeks. There are a few different ones available throughout the state of Michigan. So just again, addressing a lot of the issues with infant and maternal mortality rates. And then also, I remember a few years ago, Governor Whitmer made racism a public health crisis. So that was another way to address some of the racial health inequities.
Has there been any thing done talking about how including doulas in the care has impacted the infant mortality rate?
So with it depends on where we're looking, but and let me go back to the slide as well. Let me touch on a couple of statistics, numbers, just for anybody who is joining on for us. And from year to year, just to keep in mind that some of these things do change. But when we're looking specifically at infant maternal health rates, we see that statistically it decreases the number of deaths for infants by about, don't quote me on this, I want to say 16% within the last year. But again, that's specifically for non-Black birthing people. We still face a lot of the disparities in the healthcare systems because it is by design. Understanding again that through gynecology, the field itself, and the changes that were made, a lot of these practices were cultural when it comes to birth. We had what we call grand wives or midwives who were providing care in rural areas. And when that was taken from them at their cultural root, it was moved to gynecology that was ruled by white men who don't have birthing bodies and who don't understand the importance of autonomy and being able to make choices for your body because you do have that connection to your body.
Okay. And there's a question in the chat for accessing doula care. Can you address private pay, insurance paid, or et cetera?
Of course. So with again the Health and Michigan Department of Health and Human Services, they are covering doula care through Medicaid currently. That could change, as we know, a lot of the cuts to Medicaid and attacks on Medicaid services. But currently, yes, it is covered by Medicaid. For commercial insurances, some of them will provide reimbursements, but not all. It's not always a covered service on commercial health plans. But what they sometimes will do is provide you with a super bill, which is a breakdown of all the services that you've received, whether that be prenatal, labor and delivery, or postpartum. Some insurances will reimburse for that. And then as far as private pay, yes, a lot of doulas do provide private pay, whether that be based on income, based on certain factors. Private pay typically is available.
Hi, Leah. This is Marion, and I have, I think, maybe a two-part question. My first question is, I know that when people distrust healthcare, they delay going in. And so, do you know, is there any data on having access to doulas? Is that encouraging birthing people to begin any prenatal care earlier in the pregnancy or in the process? That's my first question. And then my second question is, how early in pregnancy or birthing process can doulas can partner with birthing people?
Yeah, thank you. That was a really good question. So for doula care, typically I've been seeing an increase with providers encouraging that as they understand just how much easier it is for them in the overall liability to the system as far as the healthcare hospital. With some doulas, they will encourage people to engage services for doulas in the second trimester, just because that's more so when a pregnancy is considered viable. But yes, typically if it's not recommended that a doula be had for a client by a provider, it's usually a family or a friend or someone they know, word of mouth, who had an experience positive with a doula, and they'll encourage them to get one. Does that answer your question?
Yes, thank you.
You're welcome.
Someone dropped in the chat too, clients can save funds to pay for doula care. That's awesome.
Certainly
I didn't
can.
know that.
Yep, HSA, FSA can be saved up for doula care. So if it's something again that your insurance is going to pay upfront based on a deductible or something as small as like co-pays for visits. And then it's something that you can save up for and practically reimburse yourself for that you saved up.
Kylia, are the hospitals that have birthing centers here in Grand Rapids, are they all using or allowing doulas in their facilities to help with birthing?
Mm-hmm. So it's kind of a catch-22. It depends on the civic system, but with some hospitals, what they'll do is they'll treat doulas as a visitor versus as part of the care team. Whereas even within those same hospitals, it can be also up to the discretion of the provider. So, for instance, if a birthing person goes in and they're wanting to birth vaginally, what will happen is something changes the trajectory of what their birth will look like. And they'll, for instance, have to get a C-section to either save themselves or their baby. And there will be an anesthesiologist who is going to administer some type of local anesthetic or also put them to sleep. It just depends. Sometimes they won't allow doulas in an operating room because there's either one person allowed that is not the client. So a lot of the times that'll be like a family member, the partner, whoever's there to support them, or they'll just say no one besides that person who's being operated on is allowed in there because of things such as what they'll call a sterile field. So they won't want anyone who's not a trained person in certain things to be present in the operating room.
Okay. And somebody's asking in the chat, how does somebody find a doula to hire?
Yeah, so you can refer to the consortium's provider directory. There's a couple others. MDHHS specifically has a list of all doulas in the state of Michigan who are registered there. And it provides information for what services they provide, whether that be prenatal, labor, and postpartum, and then also what counties they provide services in. So I'm also listed on that directory. I provide services here in Kent County, Kalamazoo, Ottawa, Washtenaw, and Wayne counties.
Does Baxter Community Center also have a listing?
A listing as far as the doulas?
Yeah, I'm looking at it, not seeing it. But someone is asking, is special training required to work as a doula?
It depends as well. For the state of Michigan in particular, they don't require you to be what we consider a certified doula. So that's through like an internationally recognized training program like DONA International, where you can practice not just in the state of Michigan, but you'd be able to practice anywhere because the standards of practice are the same for that training. Whereas like some local trainings may be specific to that state. So yeah, there's different training opportunities still within the scope of doula work, whether that be breastfeeding support, peer-led breastfeeding support. There's CBCs, IBCLCs, so that specifically in the realm of human milk feeding. There's also things like placenta encapsulation, so understanding how to handle a placenta after it's been delivered. So many different things, car seat safety, natural birthing, so on and so forth. A few different things as far as niches that you can get into as a doula.
Another question. Someone's in nursing school right now. Do you have any tips for future nurse on how to best care for queer and BIPOC birthing persons?
I would say always, first and foremost, keep an open mind if it's not something that you directly identify with. And then always being a listening ear and understanding that you're not the expert for their experience. So just understanding how important it is for them to feel they can trust you to at least listen to what their experience is and then asking them what their needs are so that you can figure out what you have in your toolkit to be able to help them throughout their journey.
And I will say too, I mean, I do a lot of trainings around LGBT topics, specifically in healthcare. And first and foremost, we always talk about language, and the language you use makes a big impact, and it starts the visit immediately. So there's a lot of opportunities, depending on where you're in school for nursing at, for training on that, and a lot of online options too. Do you have a source for training? I'm pulling up the DHHS one, and I'll put the link in the chat. And then how long does a doula provide care? I'm aware of prenatal, but do you provide post-care as well?
So myself, I am a full spectrum doula. So I provide care from preconception, which means before a person decides that they want to become pregnant. So looking at any type of existing health conditions and working alongside, collaborating with their primary provider to make sure that they're healthy for pregnancy, that they'll be able to sustain that pregnancy. Also provide prenatal, so throughout the pregnancy journey, looking at things like nutrition, education, what to expect in labor, so going over all the things. And then also labor and birth, so being there during their delivery, however long that takes. And then I also do provide postpartum, so that'll be typically, it's covered 12, 16 weeks a year for MBHHS for them to receive doula care.
And there's a couple of links in the chat on training programs. I see Lindsay put one in Find a Doula International. So finding a doula, and then I dropped in the one from the state of Michigan.
Thank you. And don't be afraid if anybody wants to come off of mute to just talk about anything as far as policy impact, any personal stories, questions, curiosities about the birthing journey, the pregnancy journey.
Hey, Kylia. I was just about to come off when you said that. I was wondering if you could speak to the mental health experience as you're providing the service to your clients and what that's been like and what it looks like for others.
Yeah, for sure. So we have this term we call secondhand trauma, specifically within doula care. So the same things, basically what that means, the same things that our clients experience, we experience with them. Again, as doulas, we provide physical, emotional, mental, and spiritual support. We're not licensed clinicians or providers, but we are close support people for them. So with it being our duty and responsibility to protect them and make sure that they're informed with all their decisions that they make, sometimes we do, unfortunately, experience the same trauma that they do. And that's something that we try to prevent. So whether that's experiencing the trauma that they do, and then also having guilt attached to that, this is a pretty big one. But for myself, like I always am okay as long as I know I did my job and making sure that my client is informed, and always letting them know that it's never too late for them to change their minds when it comes to their care and their body. Does that answer your question?
No, absolutely it does. I just wanted to ask because I know that you do a lot of that work too. So I wanted to uplift that because I know that's a very important piece, especially in the work that you're doing. My other question was in regards to the political climate. Are you noticing clients having like any fears in regards to any doula services or like trying to bring you into the hospital as a support at all? Like, has anything changed in the past couple months?
It's surprisingly not been a change based on the political climate within doula care. It's more so being in the hospital setting. And most of the time that is because they don't understand going into being pregnant, what changes they'll have to their body, and what to expect after giving birth, especially if they don't have that support and don't understand just the overall responsibility, not just for their bodies, but for the children that they're raising. So a lot of the times that's what the fear is, not so much based on the politics of it, because a lot of the people that I serve are already marginalized. So they already experience these things. And it just is kind of like they're used to surviving and getting through. So it's not so much based on the changes. It's kind of like we're gonna bear the grunt and we're gonna get through it either way. So
Kylia, someone's asking, do the doulas work with postpartum depression issues?
we do look at those. That's something that I educate my clients on first and foremost, and their support people. Because a lot of the times when your body's changing, hormones are changing, you don't notice when you're a different person. I think when everybody becomes a parent, whether that's the birthing person or the non-birthing person, they're going through some type of metaphysical change. So being able to identify what that looks like for postpartum depression is important, what the symptoms and signs are, and just ensuring that they're staying connected, most importantly, so that they can see changes in each other and alert myself, a doula, who would then refer them to their primary provider for further care instructions and plan.
I'm just going to jump in and give clarification about my shade towards Dona. The original founders of Dona, Penny Simcom, she has provided a great template, but over the decades, I personally have seen you can find a better training organization that is been developed specifically to serve the most marginalized population groups in our nation. And unfortunately, Dona is not one of them in my perspective. I'm trying to think, one of my favorites is at BDOT, but there are so many training organizations that have grown from the need to have culturally aligned and how to interact with the most marginalized communities, and Dona is not one of them. They're kind of like stuck back from when they first started, in my perspective. People can find trainings that align with them. I just always try to steer people away from Dona because I do think that there are much better choices, and having doulas in the state trained from multiple organization creates a broader diversity of doulas to train from.
So, and this is Lori. Lori, tell them who you are.
Okay. I'm Lori Vance. I'm a licensed midwife, CPM, certified doula, mother of 12, community health worker. Hopefully I'm doing a good job of not just being an ally, but an accomplice. And it is in my heart. I stay in this work so that I can center and support the people who we stole this wisdom from. When we stole people and brought them across the ocean, we stole their knowledge and we suppressed it and we tried to erase it. And my goal, along with reducing maternal and infant mortality, is to support the people that we stole the midwifery knowledge I hold. I know did not come through Ina May Gaskin. It came from the grand midwives of the South. That is the midwifery heritage we hold on the stolen land that we get to live on because of all the things colonization has done. That's who I am.
Thank you for sharing that, Lori. Yeah. Sorry, Kylia, someone's asking, do doula counsel a person who is considering an abortion?
We do. Doulas provide abortion counseling, being able to go with you to an appointment like we would any prenatal, labor, postpartum appointment, and what that looks like afterwards, and also working alongside, again, a mental health professional and a clinician, provide any type of counseling that you may need. And there are also what they call end of life or death doulas who provide care when someone loses a family member, a pregnancy, so on and so forth. So any type of like grief support.
Right. Someone put a note in about Postpartum International has directories and they have BIPOC alliances. Um, let's see. I think that's all the questions in the chat right now,
Okay.
unless I missed one. If I missed one, please let me know.
And then what I'm going to do as well, in case any more questions drop into the chat, is provide my contact information. Feel free to screenshot this here. This is what my business card looks like. I made it dramatic for this presentation and colored it a little bit, but same information available. This is my direct contact number for any type of prospective clients for who need doula services. My email. I'm located physically here in Grand Rapids, but again, I do service Kent County throughout Ottawa, Washtenaw, Wayne, and forgetting a very important county, Kalamazoo. And then I'm also on social media, not as heavily as much, just because I prefer to decolonize my care. I don't want to be sensational or provide information at this point duplicated. There's so many great midwives and other doulas who are providing information about birthing. But again, just another point of contact. I know some people prefer social media, so I am begrudgingly there and post sometimes as far as information that I find really useful. And then if we don't have any other questions, I can move into my closing message for you all. All right, so today is June 5th. It would have been the 32nd birthday Earthside for Breonna Taylor. I wanted to name her specifically in this space, not only because it is her birthday, but because again, the topic that we're discussing as far as intersectional care when it comes to healthcare. Breonna's life just reminds us of the urgent need for justice and abolition in these spaces. Her legacy just inspires us to advocate for systemic change and support BIPOC communities in birth work. Specifically for Breonna, not only is her legacy is not her death, but it's how she lived as a Black woman, as a Black femme woman who wasn't protected in the end of her life. We just understand that we are the ones who need protecting, being marginalized communities, understanding that the systems that harm Breonna are the same systems that ignore Black pain, silence Black birthing people, and deny LGBTQ plus folks the right to safe, affirming care. So I want to say and commit in her name to creating birthing spaces where we are safe. Safety is not a privilege, but a birthright for us all. Considering the care that is radically inclusive, trauma-informed, and community-rooted, and uplifting Black lives not only in protest, but in practice, again, advocacy and action, so that every client, every interaction, every policy, we're able to challenge to keep each other safe.
Kylia, thank you for ending this with that honor. I really appreciate it.
Of course.
Thank you so much, Kylia. I have a few closing announcements. This is Natalie again. I don't know if I'm on the screen. We just want to thank Kylia for taking the time out of your life to share this information with everyone. We appreciate how your work is impacting the LGBTQ plus community. Again, we would like to remind everyone about our Give Butter campaign. The link has been dropped a few times in the chat. Please feel no obligation to give, but if you would like to, we thank you so much for your contribution. You will be receiving a follow-up email soon after this webinar about all this information and links. If you are receiving CEU credits for the webinar, the link has been dropped in the chat a few times. It will also be in the email. I would like to remind everyone again that this session was recorded and will be uploaded to our website within the next few days. Our next health education series is this coming Monday, June 9th. The topic is queer affirming sex therapy. I also wanted to share some information about two new programs that we have started in 2025. The first is called Queers Queries. Queers Queries is a safe space for healthcare workers to share their experiences and learn from one another. And the other program is called Journey to Belonging, which is committed to building and a supportive and inclusive community for individuals and families who are on their LGBTQ plus journey. Our goal is to create a safe space of belonging, understanding, and acceptance for everyone. Information about both of these programs will be included in the follow-up email that I just mentioned, and information about Journey to Belonging can be found on our website under the Programs and Projects tab. Thank you again for attending, to all of you, and to Kylia for presenting, and we hope you all have a wonderful evening.
You're welcome. Have a good evening, everybody.
Happy Pride Month, everyone.
Happy Pride Month!